Good morning, all. I am Shruti Vora, student of physiotherapy from Marwadi University. Today, I am explaining the benign paroxysmal positional vertigo. Definition: BPPV is a peripheral vestibular disorder characterized by brief episode of vertigo triggered by changes in head position relative to gravity. It occurs due to displacement of otoconia, which is one of calcium carbonate crystal from the utricle into the semicircular canal. Most commonly, posterior semicircular canal are affected. This is the affected part in a BPPV. You see in a picture, this is a semicircular canal and this is otoconia. Here it is the etiology. Common cause includes idiopathic head trauma, vestibular nutrase, age-related degeneration, prolonged bed rest, and ear surgery, migraine, etc. Here you see in a picture trauma to head, rapid movement of head, migraine, inflammation of inner ear, inflammation of vestibular nerve. Then clinical feature: sudden brief episode of vertigo at least for a few seconds, not more than 1 minute. From this clinical feature you are identify which patient has a episode of vertigo, and sometimes some patients are just act like they are feeling vertigo. So you are identify which is affected or which is non-affected patients. Vertigo is triggered by turning in a bed, looking up, behind, forward, sudden head movement, and other clinical features are nausea, vomiting, imbalance, unseatedness, positional nystagmus, no hearing loss. Here it is the picture of some symptoms like dizziness, spinning, nausea, vomiting, loss of balance, blurred vision, nystagmus. Here it is the diagnostic test. Dick's Helplich test, most commonly used test for posterior canal BPPV. Positive finding is reproduction of vertigo, rotatory nystagmus after a short latency. Here you see how to perform this test. First step is you are sit with your head turned 45 degree and eyes wide open. Second step is aided by your healthcare provider. You will lean back with one ear pointed to the ground. You will stay for 1 to 2 minutes. Third step is your provider will check your eyes for nystagmus. Here it is the differential diagnosis like vestibular neuritis, Meniere disease, central vertigo, cervical vertigo, migraine, etc. Management of BPPV. First is medical management. Vestibular suppression, it is a short-term management, and antiemetics if severe nausea is present. Second one is repositioning maneuver. These physical movement are the most effective treatment of BPPV. Here it is ampli maneuver, a series of head movement designed to guide crystal from semicircular canal back into the utricle. Second one is Simont maneuver, a rapid movement maneuver used for posterior canal BPV. Third one is BBQ roll. This is especially for horizontal canal BPV and self-perform ampli. Patient can be taught to perform ampli maneuver at home. Precautions: avoid sudden head movement immediately after treatment. Fall prevention education to the patient. Assist during balance activity in elderly patients. Here it is prognosis. Symptoms usually improve with repositioning maneuver. recurrence may occur in some patients. So here our topic is over. These are the references for this topic. Thank you for listening. Have a nice day.